Alright, well, last week, somehow, I became the guy on Twitter who has to explain women's health and the entire menstrual cycle to everyone. And mind you, this isn't even the first time that this has happened. And also, mind you, I'm an internal medicine doctor, so I haven't done primary GYN care since residency. And I barely met my graduation requirements for pap smears, which is only like 10, because patients would keep requesting a female doctor in the office instead of me, which they're totally allowed to do, by the way. It's just like I feel really weird about being the one doctor guy on VTuber Twitter trying to be like the one to educate you all. Because genuinely, it feels like mansplaining. Like, OBGYN Dr. VTuber, where are you? Can you go to med school and debut already? I will pay your student loans. Anyway, based on some requests by fans, I did want to go ahead and make a quick video on what I believe should be the bare minimum basics surrounding women's health, reproductive anatomy, and important topics like birth control. In my experience, unlike men's health or genital anatomy, this is something that people just sometimes know less about, through no fault of their own. In the US especially, public education on these topics are lacking, or at least very polarized across the country. I went to high school in like a more liberal part of the Northeast, and I think I had a very solid sex ed class in high school that provided me with the knowledge and the mindset to approach these topics appropriately, even at 15 or 16. Meanwhile, I've talked to a bunch of people from across the country who only had abstinence-only education drilled into them since middle school.
Don't have sex, because you will get pregnant and die.
It even blew my mind during my first year of med school when one of my male anatomy lab partners started dissecting our cadaver during the pelvis unit, and just out of nowhere he was like, wait, there are 2 ovaries? Huh? If you've been following this channel from last year, you might have seen me make some of these videos already with my good friend Yum Princess. This one will basically be the non-ASMR version of that. So let me at least lay down some basics for that ignorant man in your life. Send this to a friend, a brother, a partner, or just someone who genuinely wants to learn more and understand what 50% of this population lives with every day. Without further ado, let's start with the anatomy. So these are the ovaries. There are 2 of them located in the pelvic cavity that produce the female sex cells known as oocytes, or eggs. They release 1 egg at a time during the menstrual cycle in a process known as ovulation. They also secrete estrogen and progesterone and regulate the menstrual cycle and secondary sexual characteristics of the body. These are the fallopian tubes. They are the ducts that transport the oocytes from the ovaries to the uterus, provide the site for fertilization, and support early embryo development through ciliated and secretory epithelial activity. This is the uterus, also known as the womb. It is a muscular organ that, in the case of pregnancy, supports the implantation of the fertilized egg and the development of the placenta and the growing fetus. Before pregnancy, the endometrial layer undergoes changes in thickness and vascularity in response to the ovarian hormones during the luteal phase of the menstrual cycle. In the absence of pregnancy, when there's no fertilized egg implanted in the uterus, the endometrium regularly sheds. This is called menstruation, and also what's commonly known as a period. This is the cervix, the lower part of the uterus that acts as a barrier to pathogens, regulates sperm entry, and facilitates pregnancy and delivery by staying closed and only softening and dilating at the time of giving birth. The cells in this area are frequently implicated in HPV infections, and this is what pap smears will scrape in order to test for the virus or abnormal cells that are at risk for developing into cancer. This is the vagina. It's a fibromuscular canal connecting the cervix to the external genitalia, serving as the site for sexual intercourse, passage for menstrual flow, and birth canal during delivery. The vagina also serves as the first obstacle sperm cells need to overcome in order to eventually reach and fertilize an egg cell. It's a self-cleansing tract that maintains a strict pH balance to keep a healthy growth of normal vaginal flora. When the pH is disrupted, overgrowth leads to infections such as bacterial vaginosis or vaginal candidiasis. Now, separately, this is the urethra. It is a completely separate tract that originates from the bladder and exits at the urinary meatus in the vulvar vestibule. Much like a male urethra, it is connected to the bladder and exits through its own hole. This is a separate opening from the vagina. Do not go into the big 2-6 still thinking that women pee from their vaginas. Did you get all that? Please keep in mind that this is a super top-down review of the anatomy, and I barely touched on these systems' functions as they relate to women's health as a whole, but I genuinely hoped that you learned something here. Switching gears, let's use this lesson to approach our next topic of birth control. So let me ask you a question. What is the most effective method to learn about? If you said abstinence, oh, if young people just don't have sex, then it's 100% effective. You're actually very wrong. Many studies have shown that abstinence-only education actually does the opposite of what it preaches against, and full sending it on programs designed to encourage fear or unhealthy responses amongst young adults having sex only increases the prevalence of their honestly justifiably risky behavior. Studies funded by the US government throughout the 80s and the 90s actually led to an increase in teen pregnancies and STIs, and the US continues to rank first in both of those categories among developed nations. So let's continue to learn about the best ways one can practice safe sex and reduce the risk of consequences like teen or unplanned pregnancies. In line with the rest of this video, we'll be talking about birth control from a primarily female perspective. Also, I won't be going over male or female sterilization in the young adult population, even though they can be legitimate and have their own use cases for certain pathologies, because those are surgical management options, and I'm not a surgeon. I'm not prescribing these medicines or doing the actual surgery, so I feel like I'm not the best person to talk about them. When deciding on a birth control, it's important to discuss with your doctor about your goals with contraception, any potential side effects, and how they might interact with your own medical conditions and history. You should feel safe to vocalize your concerns and expectations about contraceptive options. Many people don't take the time to understand the mechanisms of action, the hormonal content, the reversibility, or the risks and potential complications of what they're given. It involves only having unprotected sexual intercourse during the least fertile window of the menstrual cycle. This requires careful timing and planning and is ultimately only 77% effective at preventing a pregnancy when used by itself. The rate can go up when combined with other birth control options, but it's quite unreliable as a whole. The withdrawal method, aka pulling out, is exactly what it says it is, and it's only about 80% effective at preventing a pregnancy when used by itself, and that's even assuming that it's even happening in the first place. Single-use methods are primarily aimed at preventing sperm from reaching the reproductive system. These need to be applied each time you have sex and include the cervical cap, which is 78% effective, and using a spermicide, which is 79% effective. The internal condom worn inside the vagina is also only 79% effective, versus the external condom worn on the penis, which is 87% effective. Condoms are very important because they are the most effective non-hormonal method and are also the only ones that provide a barrier against transmitting STIs. And no, you can't combine these. The friction would break them apart. Next, hormonal methods are more reliable, but also involve complex interactions with the female hormone system and require prescription by a doctor. Combined estrogen-progestin contraceptives are 93% effective at preventing pregnancies when used by themselves, and can come in the form of a daily pill, weekly patch, or monthly vaginal ring. By constantly introducing hormones into the body, these methods inhibit the mid-cycle LH hormone surge, which prevents ovulation from occurring entirely. By modulating ovulation, this also provides a protective benefit against ovarian and endometrial cancer. It's also very helpful in treating acne and hirsutism caused by conditions such as PCOS, and in treating pain caused by endometriosis. This is not without side effects, which include increased risk of breast cancer, blood clots, weight gain, gallstones, and depression. They're contraindicated in patients over 35 years old, or with any history of blood clots, including stroke, or who actively smoke, which is more than 15 cigarettes a day. The most reliable methods of birth control are the long-term hormonal methods. The progestin injection is also known as Depo-Provera, and it's administered once every 12 weeks with a 96% effectiveness. This works by causing endometrial decidualization and eventual atrophy, which makes the uterus a less viable place for a fertilized egg to properly implant and gestate. The thickening of the cervical mucus also makes it harder for sperm to reach the egg in the first place. This is a good option for women who have medical contraindications to the estrogen-containing methods. The benefits are that it can be resumed immediately after giving birth, and it provides protection against endometrial cancer. But it has risks of menstrual irregularity, irregular bleeding, abdominal pain, weight gain, and early reduction in bone density. So up at number 2 is the intrauterine device, also known as an IUD. It's a T-shaped device roughly the size of a paperclip that's inserted by a doctor into the uterus, with strings that exit into the vagina to allow for removal. There are 2 types, and they both create a sterile inflammatory reaction that's toxic to both the sperm and the egg. The copper IUD is 99.2% effective and can remain in place for up to 10 years, but does come with an increased risk of heavier bleeding during menstruation. The hormonal IUD releases levonorgestrel and is 99.8% effective, but it's contraindicated in patients with active breast cancer. Both IUD types are contraindicated in patients with abnormal uterine anatomy, such as in bicornate uterus or cervical stenosis. At number 1 is the contraceptive implant, also known as Nexplanon, which has a 99.9% effectiveness. It has a similar hormonal makeup to the progestin injection, but is a small 2-inch plastic rod inserted right under the skin of the arm. This needs to be done in a doctor's office, carries a risk of bruising and infection, as well as the overall risks like the injection. Alright, Yum and I also have a video on emergency contraception, its indications and uses, but to keep this video a normal length, I might save that for another one instead. If you're interested in it, please check out her work on my channel and her own. Otherwise, I hope you learned something today.